Nigeria controls the highest burden of tuberculosis in Africa, being #1 in the African continent and also the 6th in the whole world.
Kano State, being the most populous state in Nigeria, have had the highest case finding ever in the history of Nigeria by detecting over 5,000 cases in the third quarter of this year.
So in terms of the burden of tuberculosis, you can liken it to say that when Nigeria coughs, other African countries, or Nigeria sneezes, other countries will get cold.
Na fara tari a hankali. So ina yi har yasa na je kemis aka bani magani na fara shan magungunan nan. So idan tarin nan ya lafa bayan kwana ɗaya biyu sai ya dawo.
What are we doing about this? I know countries are asking and wanting to know what did we do particularly in Nigeria, what has helped us.
We started by actually forming the National ACSM Subcommittee, which acts as a think tank and advisory body to the ACSM units on the program. After which we also carried out a formative research using the human-centered design methodology, which helped us to actually address the low case case TB detection in Nigeria from the patient point of view. The treatment supporters were able to interview the treatment supporters, the TB patient themselves, the health workers, and then the policy makers at the national and the state, as well as the religious leaders. And from what we got from the various interviews, actually revealed why we've been having the low TB case detection.
We're able to do this with multifaceted interventions. So we've been able to increase on our diagnostic platforms, the number of gene experts, introducing new platforms, TrueNat, TB Lamp, LV Lamp, and Quadrich. So we do think that all these things together by next year will improve on our case notification.
In the TB program, we try to guide against two undesired situations. That is overstocking and understocking. And the first thing we did is to develop a good logistics tools. That is inventory control system. And you need a good tools to develop inventory supplies system. And again, you must have to acquire the required trainees and expertise to ensure that the tools are properly used. And then the third one is to have a good monitoring. You have to do a good monitoring of the facility.
In 2021, we have detected the highest number of presumptive TB cases ever in Nigeria and in Kano State. We have also detected 12,845 TB patients in Kano State, and they have all been placed on treatment. And we are also expanding in our area of diagnosis. We have over 1,000 centers where people take treatment for TB. And then last year, compared to that last year, we had less than 800 centers where patients go and take treatment for TB. In terms of diagnostic, we have over 20 centers where testing for TB using gene expert machine is conducted. Last year, we had less than 17. We have over 250 centers where AAB microscopy for TB diagnosis and monitoring is being conducted. Last year we had less than 200. These are additional achievements and additional milestones for TB control in Kano, and we are looking at more and more of the detection before the end of this year, and then hopefully by 2022.
Katsam sai na ringa jin sanarwa a gidajen rediyo da talabijin duk mai yin tari wanda ya wuce tsawon sati biyu, so ya garzaya ya je asibiti mafi kusa da shi, za a ba shi magani, za a kula da shi kyauta. So hakan ne ya bani dama na je asibiti mafi kusa da ni, aka bani roba na kaki, aka yi mun gwaji, aka ce na dawo washe gari. Da na koma washe gari, result ya fito, aka bani, aka ce ina dauke da wannan tari. Hakan yasa aka bani magani, aka auna nauyina, aka faɗa min adadin maganin da zan ringa sha a kullum. Na kammala shan maganin nan kuma na koma harkokina, na koma kasuwanni, na filin wasanni na ball da makamantansu. Tunda yanzu na yi tsawon wata 6 na kammala shan wannan magani.
The treatment coverage has improved significantly from the baseline of 24%, which we were in 2018, to 45% this year. It's very important for us to also know that last year we were at 30%. So there has been a significant improvement of 15%, even as we are still at the third quarter of 2021.
I feel that Nigerian TB program is moving to a greater height. We are getting the results, and I'm not seeing us going back in any form. The human resources are available. We are galvanizing our partners in the right direction. We are also implementing the right interventions. So for me, I think TB program is going to a bigger and a bigger level. Our hope is that we see a situation where TB program is the spear lead for all the other programs in the country, and also globally. We have had instances where our strategies, our interventions are now meant to be a global issue, and we have actually tried to also showcase that we are one of the best, and we have the human resource to showcase that. And we keep building capacity at all levels to carry this program along to the level that we know is going to be.
As we are crawling into the end of 2021 and moving to 2022, what we see is a situation whereby the demand creation we have on ground, with the support of the leadership in the ministry through our director and the oral commissioner, is to see more TB detected, more TB patients diagnosed, more TB patients placed on treatment, as well as more patients put on treatment for TB once diagnosed. We also want to see a situation whereby information is passed to the general public on symptoms and signs of TB, as well as measures to prevent TB, because when you diagnose a TB patient and you put that on treatment, you are also breaking transmission and preventing the spread of the infection from other people in the community, in their vicinity, in their family, in their neighborhood, in their workplace. We are also looking at opportunities for more domestic resource mobilization for TB, because we know the number of diagnostic centers need to also cover more areas in the state. We know the resources needed for TB are much, so we know with the support of government and partners and stakeholders, we can get more resources from within the government, from within the institutions, from within our society, from within our communities, from our domestic resources, from our philanthropies, for more resources for TB.
I can just tell everybody to watch out for 2022, our strategic initiative that is coming up, and I think it's going to give us opportunity to tell this story to the whole world. The national coordinator is excited, looking up to that meeting. The PMU team lead, he's also one of the people who birthed the vision together with Dr. Moni, WHO, amazing Dr. Moni. They all together birthed this vision of strategic initiative 2022, and I think everyone should watch out, and let all hands be on deck as we put this thing together for the world.
Kano has been at the forefront of the states being supported by Breakthrough Action Nigeria, and the mass demand creation we have in Kano State is not unconnected with the support we get as a program from the Breakthrough Action Nigeria, and we see an opportunity for an expanded awareness creation in the most populous state in the country. We see an opportunity for more information to be shared in various platforms through the support of Breakthrough Action, and we see an opportunity for people to be more enlightened, more educated for TB or on TB or about TB in Kano State, and we see an opportunity whereby, as we are seeing the end of TB in Kano and Nigeria, Breakthrough Action will always be there by our side to support us to see to the promised land.
I want to use this opportunity to appreciate our partners, the Global Fund, who is supporting the country in providing several services, including free drug and free diagnostic services. I also want to appreciate the USAID for support over the years in this program. USAID has supported TB program for more than 18 years, and they are still supporting us up to this moment. WHO, we appreciate your technical support and your guidance, and also all our implementing partners who are implementing several TB services in the field. We appreciate you and we thank you so much, and we hope that 2022 will bring a better year for us. Thank you.